FUE, Follicular Unit Extraction, and FUT, Follicular Unit Transplantation, are two common methods of hair transplantation, each with its own set of characteristics and advantages. Here's a brief overview of the key differences between FUE and FUT. Harvesting method. FUE involves the individual extraction of follicular units, hair follicles, from the donor area using a small, punch-like instrument. Each follicular unit is removed one at a time. FUT involves the removal of a strip of scalp tissue from the donor area, typically from the back of the head. The strip is then dissected into individual follicular units for transplantation. Scarring. FUE results in tiny, circular scars scattered throughout the donor area. These scars are usually less noticeable than the linear scar produced by FUT. FUT leaves a linear scar at the donor site, which can be more noticeable, especially if the patient prefers shorter haircuts. Donor area appearance. FUE allows for a more diffuse appearance in the donor area since the extraction is scattered. This can be advantageous for individuals who want to keep their hair very short. FUT leaves a linear scar that may limit the ability to wear very short hairstyles without the scar being visible.
Before we continue, please visit roothairtransplant.com for more information.
Recovery time. FUE generally has a quicker recovery time, with minimal discomfort and no sutures. Patients can typically resume their regular activities within a few days. FUT involves a longer recovery time due to the need for suture removal and potential discomfort at the donor site. Graft survival. FUE. The graft survival rate is typically high, as the follicular units are carefully selected and transplanted. FUT. Graft survival is also high, but there may be a slightly higher risk of transection during the dissection process. Suitability for patients. FUE. Suitable for patients who prefer to wear their hair short and want to avoid a linear scar. FUT can be a good option for patients who have a larger area to cover and are not concerned about having a linear scar. Ultimately, the choice between FUE and FUT depends on various factors, including the patient's preferences, the size of the transplant area, and the quality of the donor hair. It's important to consult with a qualified and experienced hair transplant surgeon to determine the most suitable method based on individual circumstances.